Today is Tuesday, June 24th, and I'm Zach Caruso. Our lead story this week is from the Journal of General Internal Medicine and is titled Joint Clinical Practice Guideline on Benzodiazepine Tapering, Considerations when Risks Outweigh Benefits. ASAM, in collaboration with 9 other medical societies and professional associations, developed evidence-based guidelines for tapering benzodiazepine medications across various clinical settings. These guidelines were created using a modified grade methodology and a clinical consensus process, which included a systematic literature review and several targeted supplemental searches. The guidelines were also revised based on feedback from external stakeholders. Key recommendations include that clinicians should continually assess the risks and benefits of benzodiazepine use and tapering. They should encourage in shared decision-making with patients and avoid abrupt discontinuation in individuals who may be physically dependent or at risk of withdrawal. Tapering strategies should be personalized and adjusted based on the patient's response. Additionally, clinicians are encouraged to provide psychosocial support to help patients successfully taper off of benzodiazepines. A new article in Heart is titled Cardiovascular Risk Associated with the Use of Cannabis and Cannabinoids, a Systematic Review and Meta-Analysis. Cannabis use has increased significantly in the last several years, and the authors conducted a systematic review to assess its association with major adverse cardiovascular events, or MACE. The meta-analysis included 24 studies, and they found a significant association between cannabis use and MACE. The authors found an association with increased acute coronary syndrome, stroke, and cardiovascular mortality. Of note, there was significant heterogeneity among the studies, but authors note that when they limited analysis to the cohort studies, the findings were consistent. These findings are consistent with prior findings and highlight potential risk associated with cannabis use. Next is an article in the American Journal of Psychiatry titled Comparing Prescription Opioid, Benzodiazepine, and Stimulant Misuse Rates Among Patients with and Without Telehealth Service Use. Telehealth has become a key part of outpatient mental health and prescribing in the U.S., especially after COVID-19 eased in-person visit requirements for controlled substances under the Ryan-Haight Act. The DEA has extended COVID-19 telehealth rules due to concerns that returning to prior rules would reduce mental health access. This study used 2021 to 2022 NSDUH data on adults with healthcare visits, comparing prescription opioid, benzodiazepine, and stimulant misuse among telehealth users versus non-users. Telehealth users had higher lifetime misuse and mental health issues, but after adjusting for misuse history and demographics, telehealth was not linked to increased past-year misuse. Findings suggest telehealth serves higher-risk patients but does not independently raise misuse risk, highlighting the need for targeted policies to balance access and safety without overly restricting telehealth. Next is a study in drug and alcohol dependence titled Cognitive Behavioral Interventions for Co-occurring Substance Use and Mental Health Disorders. Mental health disorders and SUD often coexist. Combining SUD treatment with cognitive behaviorally based interventions, or CBI, has promise for improving outcomes. This meta-analysis reviews 47 randomized trials integrating CBI with SUD treatment. CBI compared to usual care improved consumption, but not psychosocial outcomes. CBI plus usual care compared to usual care alone showed significant improvement in psychosocial outcomes, but not consumption. However, when individuals treated with CBI were compared before and after treatment, there was significant improvement in consumption and psychosocial outcomes, demonstrating that 65 to 79% of individuals will show some improvement. Authors conclude that these results show CBI interventions were modestly effective. Our next article is in the Journal of Addiction Medicine and is titled Addictive-like Dimensions of Problematic Use of Social Media. Problematic compulsive social media use shows behavioral similarities to substance use disorders. Preliminary brain imaging studies have found structural and functional deficits like those seen in substance use disorders, suggesting an addictive dimension to problematic social media use. Excessive or maladaptive use of social media can trigger or worsen symptoms of depression and anxiety, especially in young people, which may further reinforce its use and increase adverse effects. To address potential negative public health outcomes, increased oversight of social media algorithms and business models is needed, along with rigorous research to identify at-risk groups, understand consequences, and develop evidence-based prevention and treatment strategies. Next is a study in JAMA Network and is titled New Benzodiazepine Tapering Guide, Slow and Patient-Centered. Authors discuss the new guidelines for benzodiazepine tapering and need for providers to be patient-centered. While long-term benzodiazepine use is generally not recommended, physical dependence and withdrawal can develop within weeks of use, and tapering may be needed in both short and long-term use. There is not a standardized evidence-based tapering protocol, and significant heterogeneity in patient response exists with the risk of not only withdrawal, but also rebound of underlying condition being treated. In this context, a slow, patient-centered taper is recommended while optimizing treatment for underlying condition and focus on patient experience and outcome beyond just reduction in dose. Our next article is in the Journal of General Internal Medicine and is titled Supporting Patients Through Benzodiazepine Tapering, a new joint clinical practice guideline. Most benzodiazepines are prescribed in primary care settings, but many providers don't feel comfortable managing tapers, resulting in patients staying on prescribed benzodiazepines beyond their clinical usefulness. The guidelines first recognize the difference between physical dependence and benzodiazepine use disorder, or BUD, and need for additional support to manage BUD. Authors recommend ongoing assessment of risks and benefits of benzodiazepine use and considering tapering when risks are greater and in older populations. Authors support starting low and going slow and noting tapers are often nonlinear and prolonged pauses may be needed, including potential long-term use at lower doses. The authors also voice the need for careful consideration when starting these medications and continuing them, given potential risks. Our final article is in the International Journal of Molecular Sciences and is titled Cortisol and Beta-Endorphin Responses During a 2-Month Exercise Training Program in Patients with an Opioid Use Disorder and on a Substitution Treatment. During opioid abstinence, cortisol levels are increased, contributing to anxiety and dysphoria, and beta-endorphin levels are decreased, known to be associated with craving and relapse. Regular exercise reduces cortisol response to stress and elevates beta-endorphin levels. Participants with OUD receiving OST were randomly assigned to exercise on a treadmill to 70% of their heart rate max for 20 minutes, 3 times a week for 8 weeks, or serve as a control. After 8 weeks, beta-endorphin levels were significantly higher in the exercise group compared to baseline and had decreased slightly in the control group. Likewise, cortisol levels were significantly lower in the exercise group compared to baseline and had increased in the control group. Results in the methadone group and buprenorphine groups did not differ significantly. Authors conclude that aerobic exercise has the potential to reduce the risk of relapse.